I want you to imagine you're on a slow sinking ship. You luckily have a life jacket and are gathered near rescue rafts. Meanwhile, others are still on the ship without life jackets and without guidance on where to go. Are you the one that turns away from the ship, leaving them to survive on their own? Or are you the one that goes to help and support them when they're stuck? I encourage you to think about how this relates to the homeless situation in our world today. What action do you take when you see 1.6 billion individuals with inadequate housing struggling with various barriers to receive their basic human right to healthcare? Today, you'll get the chance to see homelessness through the perspective of global health, which pertains to the idea of improving the quality and accessibility of health for everyone worldwide, no matter their environments, resources, and social status. My name is Mitali Chaudhari, and I'm a rising junior at Sunset High School with aspirations of practicing medicine. I currently live in Portland, Oregon, and enjoy partaking in HOSA, soccer, and the health awareness club I founded at my school. My interests lie in improving healthcare accessibility for underprivileged communities, one of which is the homeless community. Before I describe the healthcare statistics and barriers, I would like to begin with introducing what homelessness is. According to Cornell Law School, a homeless individual is an individual who lacks housing, whose primary residence during the night is a supervised public or private facility, or someone who's a resident in transitional housing. Homelessness is a part of the world's economic picture, and what we need to address is better managing and serving that percentage of the population. To do so, we must begin with looking into their fundamental right to health care. Homelessness is associated with enormous health inequalities, including shorter life expectancy, higher morbidity, and greater usage of acute hospital services. In fact, of the 150 million unhoused people worldwide, illness is 3 to 6 times higher than that of the general population. And according to the National Healthcare for the Homeless Council, people experiencing homelessness die on an average of 12 years sooner than their sheltered counterparts. This is largely due to extreme poverty, harsh living environments, trauma, and structural barriers for healthcare. Living on streets or in crowded shelters can expose them to communicable diseases, including TB, respiratory illnesses, flu, hepatitis, and more. Additionally, chronic conditions such as cancer, heart disease, and mental health problems are disproportionately higher in homeless people than the national average. In a comprehensive survey of unmet healthcare needs of homeless adults, 73% of the respondents reported at least one unmet health need, including an inability to obtain needed medical or surgical care, prescription medications, mental health care, eyeglasses, and dental care. The inability to access medications and treatments can become overwhelming when there's a need to focus on basic survival skills, including nutrition, safety, hygiene, and shelter. To visually demonstrate how people experiencing homelessness are more vulnerable to health conditions, we can begin with looking at the graph to the left from California Policy Lab's findings. Here they discover that unsheltered individuals have more significant health challenges than their sheltered counterparts. The second figure also comes from California Policy Labs, covering physical health conditions, mental health conditions, and substance abuse-related loss of housing for sheltered and unsheltered adults. Finally, the figure to the right comes from the IBM Watson Health Explorees dataset, comparing the percentage of housed to unhoused people with a variety of health conditions. As we can see, the significant gaps shown in the figures indicate that homeless individuals face a larger percentage of health issues as opposed to those that are sheltered. It's critical that all people can access healthcare. However, the growing and diversifying homeless population faces tremendous social burdens and structural barriers to healthcare, which contribute to high morbidity and mortality. To begin with, there are several logistic barriers that make accessible healthcare difficult. For example, jargon used in healthcare can make it difficult for homeless individuals to navigate through the insurance process. In addition, lack of transportation is another significant issue. In fact, based on research studies from Ohio State University College of Medicine, 1 in 3 homeless youth report transportation as a top reason for why they don't go to local community clinics. In addition, even after reaching the hospital, you can be there for hours before you're seen by a healthcare professional. This is an especially critical issue if you're in a situation where you're living in tents and can't afford to be away from your possessions for too long. Another barrier is competing priorities, since the daily struggles of securing shelter, food, and clothing frequently takes precedence over healthcare. Additionally, there's also a stigma around homelessness that needs to be changed. If people walk in and aren't showered or clean or don't meet a certain criteria generally accepted within society, they're treated poorly. These stigmas can cause homeless individuals to distrust the healthcare system as a result of experiencing discrimination from providers. It's important to realize that it's not right to send unhoused people to a healthcare system that's going to treat them like second-class citizens. We should not address a homeless person as if we're talking to another population. They are part of our society of human beings and do not deserve to be treated any less. Finally, there are policy barriers that need to be addressed. For example, in the United States, there's no universal health care, and therefore, with the lack of health insurance, scheduling healthcare appointments is extremely difficult. With that being said, there are homeless individuals from Canada, countries in the European Union, and other countries with universal health coverage. However, they still experience limited access to healthcare because of factors including competing needs and priorities, limited physical access to healthcare, difficulties in contacting providers, and discrimination. With that being said, there are several programs that work towards building a more equitable and high-quality healthcare system, one of which is outreach. Outreach is the idea where programs go out to the street, under bridges, into woods, into alleyways, all to bring care to people and meet them where they are at. Additionally, organizations have also added clinics to common areas such as shelters and soup kitchens. This makes their healthcare much more accessible. Another action being taken is case management. Case management is a collaborative process to help assess, plan, implement, coordinate, monitor, and evaluate options and services to meet an individual's needs. This specialized help is another great way to help get past the logistic barriers. To address distrust of the healthcare system, there are groups that work with emergency medicine physicians to talk to them about how they can more responsibly treat people experiencing homelessness coming into the emergency room. Another initiative being taken is working with medical schools to train physicians to get exposure to the situation. By helping primary care physicians modify their bedside manner, it can help reduce the discrimination individuals face and therefore help earn trust. We addressed how navigating the process of scheduling an appointment can be a barrier. However, peer health navigators can help with insurance, health goals, and taking people to their appointment, whether that be dropping them off, going in and helping advocate, or just being an additional support. Finally, there's medical respite care, which is short-term residential care that allows individuals to rest in a safe environment while accessing medical care. Now I'd like to present you with the same situation we discussed at the beginning of this presentation. Imagine you're on a slow sinking ship. You have a life jacket and are near rescue rafts while others are still in the ship without life jackets and without guidance on where to go. Are you the one that turns away from the ship, leaving them to survive on their own? Or are you the one that goes to help and support them when they're stuck? If you're the person that goes to help and support these individuals, just like helping and supporting the vulnerable people in our society today, I would encourage you to advocate. Advocate at every level, whether that be community, the state, federal. Raise your voice, write letters, stay resilient, and educate public policymakers, mainstream healthcare providers, the general public, and continue to educate yourself. Do not underestimate the impact the youth of our generation can have to help make a difference in the lives of others. Here are references to the sources I used for this presentation. I would just like to take a moment to thank Ellen Velez, the Senior Manager of Health and Wellness for the Transition Projects, Del Seymour, the founder and executive board member of Code Tenderloin, and Bobby Watts, the Chief Executive Officer of the National Healthcare for Homeless Council. I'm very grateful for the time they took to meet with me, which helped me meaningfully enhance my presentation. In addition to these wonderful people, I would like to sincerely thank the Global Health Leaders Conference at Johns Hopkins University for giving me the opportunity to speak. I would also like to thank my family for all their support. Finally, thank you all for your time, and I hope you've been able to gain a meaningful understanding of healthcare accessibility for homeless individuals in our world today. Feel free to contact me if you have any further questions.